Heart disease, think again. It is the #1 killer of men and women in our country. That's the bad news. The good news is heart disease is largely preventable. Dr. John Luber is a cardiothoracic surgeon with CHI Franciscan Health. I thank you for being here. It, of course, is Heart Health Awareness Month, so a big part of that is awareness and also education, as we were just talking about in the break. And before we get through some of the specifics about heart disease, we're dealing with a winter storm, and we've got some heavy, wet snow outside, and a lot of people aren't used to it. They're shoveling. What do we need to be concerned about when it comes to heart risk and doing an activity like that?
Clearly, this kind of event triggers heart attack, it triggers stroke, and it triggers another even more catastrophic event, the ascending aortic dissection, where the aorta, as it comes out of the heart, actually tears. So anybody who's in a risk category or who has already had an event needs to be very, very careful about overexertion. With exertion, pulse goes up, blood pressure goes up, events occur. So you're just asking for a difficulty to go out and shovel a 30-foot long sidewalk with 8 inches of snow on it. Better to leave it to the neighbor to find somebody else that can do it. But don't put yourself at risk by taking your body beyond the stress limits which it can endure.
Okay, a very good warning. So think about that if you're headed out in the morning. So heart disease, we were talking about the statistics. 1 in 3 women dies from heart disease a year. It's the #1 killer of men and women. What do you want people to know this month when it comes to our risks for heart disease?
Well, there's several things to know. One, intervention and prevention is an educational event. So people need to understand what the risk factors are, the things they can do from a lifestyle modification standpoint that can actually alter the occurrence of fatal events. High blood pressure, high cholesterol, smoking, diabetes, obesity. Those are the things that we have control over. We can quit smoking. 16.5% of women in the United States still smoke. 3,800 children under the age of 18 begin smoking every day. 1,000 of them begin smoking on a continual basis. We can stop doing that. We can lose weight. 40% of women in the state of Washington, by definition, are obese. Exercise helps reduce that as a risk factor, which also changes our glucose tolerance, our pre-diabetic status, which alters our risk of disease occurrence. Controlling our blood pressure is a really important thing. And in those people who are heavy, exercise becomes a benchmark measure of our ability to change our risks. So those are the things we need to intervene in. And we need to understand also that women more frequently die of their first heart attack, that 2/3 of the women who have their first heart attack have no preceding symptoms, that in point of fact, 30% of them, up to 30% of them, have a normal angiogram after an anginal event and never get treatment because the physician feels there's nothing to treat, where they have small microvascular disease that needs to be treated. So medication adherence is a very important issue in terms of also preventing the disease.
I'm glad you talked about heart attack in women. What's the difference in symptoms for a woman versus a man when they're having a heart attack?
Right. There can be some differences. The truth of the matter is that the majority of women who present do present with standard symptoms: pressure in the chest, pain in the jaw radiating down the left arm. But there's also diaphoresis, sweating, just not feeling well. That is quite often mistaken for other disease processes, and the patient doesn't even get an appropriate workup in the emergency room. What I would tell people is we are the guardians of our own health care. If we are concerned, we need to push until we get an answer, because quite often in a busy emergency department, you will not get a good answer, or you will not get immediate care. And so you need to push and be your own advocate. But women quite often do not have the standard pressure. Sometimes it's diaphoresis, sometimes it's just not feeling quite right. And those are important symptoms for a woman not to ignore.
Listen to your body. Thank you for providing some very important life-saving information for us, Dr. Luber. Yeah. And you can make some healthy changes in your life right now. And it starts by joining us for the Q13 Heart Challenge. We're asking you for the month of February to add a healthy habit. Maybe it's go for a walk or drink more water, or drop an unhealthy habit for the entire month, and do so tweeting using the hashtag Q13 Heart Challenge. We're going to be covering this all month long, so stick around for much more information as far as your heart health. And thank you, as always, for what you do to help us be heart healthy.
My pleasure.
Matt.
We have an update on some